My name is Elke Kellis and I'm one of the psychologists here at the Red Couch. And today I just wanted to make some brief comments about how to get the most out of therapy. For most of us, when we first start thinking about doing some therapy work, it can be quite daunting and confronting. And I'm hoping that some of my comments today might be helpful for you along the way in choosing the therapy that's right for you and to get the most out of that therapy work. To begin with, I think it can be really helpful to do some research. There are lots of different therapies and psychological treatments out there, and it can be helpful to start to get a little bit of a sense of what they are and what they entail, so that you can make an informed decision about what might be best suitable to your needs at this time. You'll come across words like CBT and ACT and narrative therapy and schema therapy, and it can be helpful to just get a little bit of an introductory sense of what they're about and how they might suit you. Once you have a little bit of a sense of what type of therapy you might need and that might suit you at this point in time, it can be really helpful to then look at who is available to do that work with you in your local area. Most psychologists have some of the information about their work on the website, and it can be helpful to have a look through and to see who speaks to you in some way. Once you've shortlisted a couple of people that you think might suit you, it can be helpful to make a couple of phone calls and to speak with people over the phone. Now, for psychologists, that can be a challenging thing to do if they're in consultations throughout the day. But even just a 5 or 10 minute phone call can start to give you a sense of whether that's the right person for you. Now, the right person doesn't necessarily have to be the person you like the most. Liking someone is important, but it's also important that the person challenges you and works hard with you to achieve your therapy goals. I liken therapy a little bit like a journey where the therapist is your Sherpa or your guide, and sometimes your guide needs to push and motivate you to stay on track, and sometimes your guide needs to be responsive to your need to rest and consolidate. So getting a bit of a sense of whether your therapist is responsive in that way can be important. As a next step, it can also be helpful to speak to your GP. Your doctor might have colleagues or psychologists that they've worked with that they can recommend. And your GP can also talk with you about whether you might be eligible for a mental health plan or a Medicare rebate or some other government funded program that might support your therapy work for a while. Your health fund might also assist in that many health funds will tell you about what your private health cover includes and the sorts of therapists and psychologists who are eligible to provide services under your cover. Once you have chosen a person and have booked that first appointment, it can be quite helpful to be clear on what your therapy goals are, to bring those along to that first appointment. The first appointment is really about getting a sense of whether you and your psychologist will make a good team. And if you can talk a little bit in that first meeting about what your goals are, what you're hoping to be different as a result of therapy, and what your sense is of what you might need to get there, can be really, really helpful. And sometimes you may not necessarily have all those answers, but start to give that some thought so that in your first couple of therapy sessions, you can start to crystallise those goals and hopefully turn them into measurable goals. We often talk about SMART goals that are specific, measurable, achievable, and also time specific, so that you can review your progress and see how on track you are during your therapy work. Finally, I think it can be really helpful to remember that therapy is an active process. We call it therapy work because you will get the most out of it if you are actively engaged in that process. So one of the things that can be helpful is to think about feedback in therapy work and to give your therapist feedback about what's helpful and what's not helpful, and what feels right and resonates with you and what doesn't. If you're thinking about your therapy journey and in particular the way your Sherpa is moving, if your Sherpa is moving too quickly and pushing you too hard, then that feedback is important to pull things back. At the same time, if your Sherpa is moving too slowly and you feel like you need a bit more momentum, then it can be important to provide that feedback too, so that you are going to stay on track and getting to your therapy goals. Reviewing regularly how you're going and checking that things are on track can also be important, and hopefully your therapist will check with you regularly how you're finding therapy and whether you're feeling on track. As a final thought, I think it's important when it comes to being active to look for opportunities to practice. We know from a lot of research that between session therapy work, or homework as it's sometimes called, can be really helpful in practicing the skills you're learning in therapy and in consolidating that work. If you think about going to the gym, if you only go to the gym once a week, it's going to benefit you, but not nearly as much as if you're looking for little ways of exercising throughout the week and practicing those skills. So that can be really important too. I hope that those comments have provided a little bit of guidance on where to start with therapy. And I would encourage you to ask lots and lots of questions along the way so that you can make informed decisions about what suits you and your particular needs. If you find that some of the points spoke to you today and you would like to check and to see if one of the psychologists here at the Red Couch might be your Sherpa or your guide through your therapy work, then please do give us a call and have a chat with us, and we'll do our best to make that journey as comfortable and rewarding as possible for you. Thank you for listening.